Happy Tuesday, Doc.
Hey Miranda, how are you?
I'm good.
Good. Let's talk about shoulder trouble.
Okay.
Okay. Shoulder pain.
Shoulder pain.
We'll go on the examiner.
Sure.
So shoulder issues are one of the more common reasons why someone might need a chiropractor. Sometimes they think they're having shoulder issues. Let's say they might complain of a lot of pain, like in the upper back and neck. They call it their shoulder, whereas the shoulder itself is more like the ball and socket joint here that allows our arm to move in different directions. What I find with a lot of shoulder issues is that there can be a shoulder problem and an upper back problem going on at the same time. And shoulders are notorious for becoming painful and having issues without an injury. So a lot of people think in order to have pain, they have to have an accident. They've got to, fall down a flight of steps or get in a car accident or lift something and they get an immediate pain. Whereas shoulders tend to be more of a, I woke up and it hurt for a couple days, it went away, and then a couple weeks later it was there again. It stayed for like a week, and then it went away, and then a month later it was there, and now it hasn't gone away for 2 months. That's more common for a lot of upper back, neck, shoulder problems, where we'll see someone come in who's like, I played sports in high school, I was really active, I'm a pretty active person now, I exercise, but I can't get this pain to dissipate. They'll often have a lot of decreased range of motion. Maybe they have pain that starts in their neck and travels into the shoulder itself. They could have pain radiating into the arm. And all of those symptoms could be a combination of a few different things at once. And I'll tell patients that as well. We'll say, you're allowed to have more than one problem. Your diagnosis doesn't have to be just this one thing. You could have a shoulder problem that also makes your neck worse. And you can have a neck problem that makes your shoulder worse. And you often have to treat both of them at the same time. A lot of times the treatment for shoulder issues is fairly short term. You make some adjustments in the office, we give them some exercises, maybe they start doing some ice, maybe they stop doing something. So if they're doing a particular workout that's just too stressful on their shoulder and neck, I'll tell them to hold off on that for a while. And then after a couple weeks, they feel better. But then also for shoulders, it could be a longer treatment time in terms of like getting the shoulder to totally heal. If it's like a rotator cuff impingement issue or a tendonitis, those don't heal in a matter of a week or two. Sometimes that takes quite a long time for the body to recover from. The key is with shoulder issues, not every shoulder pain is the same. A 20-year-old athlete with shoulder pain is going to be different than a 75-year-old woman who just wants to garden and she gets shoulder issues. So the treatment is different, the healing time is different, so the approach has to be more specific to the person. So if someone comes in with shoulder issues, I always spend a lot of time chatting with them. I want to ask them a lot of questions. I want to say, how did it start? When have you had trouble with this before? Is it on both shoulders or just one? It can often flip-flop. You'll have shoulder pain on the left and then shoulder pain on the right a couple months later. That's pretty common. But we want to make sure we spend a lot of time with those folks so that they understand exactly why they have the pain. That gives them a better chance to figure out what they got to do to help it.
Well, that's great information.
Thanks, Miranda.
Thanks, Doc.
Mm-hmm.